Hello, my name is Kathleen. I'll be your nurse today. And it says that you're here today for your head to toe assessment, correct?
Yes, that's correct.
Alrighty. And what's your name?
My name is Robert Wheeler.
Okay, and you know what today is?
Today is April 12th, Easter Sunday,
All right, and do you know where you are?
Washington, D.C., doctor's office.
Okay, and who is the President of the United States?
Donald Trump.
All right, okay. Seems like my patient is alert and oriented times 4. Alrighty. And I performed hand hygiene and I provided privacy for my patient. And there is a safe environment for my patient to have his examination, or to have her examination. Alrighty. Well, his. Um, alrighty, dear. So, what do you have any concerns today outside of your head to toe assessment?
Yeah, I've had this cough for about the past 6 days.
Okay. Oh,
Yeah, I'm coughing up this yellow green type of phlegm, and I've been having a shortness of breath and like any type of activity moving around. So I wanted to get that checked out also.
okay. And have you traveled anywhere in the past year or so?
No,
Okay. All right. Any fever?
no.
Okay. All right. Just asking those questions because of the whole COVID 19 epidemic going on right now. Okay. All right. So productive cough with yellow and green sputum for the past 6 days. And you've had having shortness of breath on exertion. Any pain at all?
Yes, my chest pain when coughing.
Okay. On a scale of 1 to 10, 10 being the worst pain and 1 being the least pain, what would you rate? How would you rate your pain?
5.
A 5? Okay. All right. Okay. All righty. Okay, so as I do your assessment today, I will pay close attention to your lungs, okay? But we'll go ahead and refocus on that when we get there, okay?
Okay.
Alrighty. I'm just looking at my patient here. He seems like he's not in any distress. He seems like he's appropriately dressed for the weather. His posture is erect. It doesn't seem his skin seems appropriate for his ethnicity. Hair seems placed where it should be amongst his body. Alrighty. Okay, and so just a little bit of history on you, okay? I'm going to ask you a few questions before we begin your exam, okay?
Okay.
Do you have any medical conditions that I need to be aware of?
I have hypertension,
Hypertension?
uh, lupus, um, and hypothyroid.
Okay. Lupus, hypothyroidism, and hypertension. Okay. Have you ever had surgery?
I've had triple bypass surgery a couple years ago.
Okay. All right. Heart surgery. Okay. Are you allergic to any medications?
Yes, I'm allergic to penicillin and Keflex.
Okay. All right. Okay. I'll note that. Okay. And alrighty. Any family history I need to be aware of?
No, not that I know of now.
Okay. And as far as your social life, do you smoke cigarettes?
Yeah, about a pack a day.
Like, do you drink alcohol?
I have a beer a day about.
Do you use any recreational drugs?
No,
Okay. Do you exercise?
a couple times weekly.
Are you employed?
Yes,
Um, what do you do for a living?
I work in IT security.
Okay, so you have a low risk job, meaning that like you're not a construction worker, which is a high risk job, meaning that they high risk for injury.
Mm-hmm.
Um, but you can be a high risk for stress. So how is that
Yeah.
going? Any stressors in your life or anything like that?
I try to let things stress me out, so not
Okay. Any anxiety, history of anxiety or depression?
no,
Okay. Any family history of any mental illness?
no,
Okay. All right. Are you? What's your marital status? Are you single, married, in a
married.
relationship? Okay. And are you sexually active?
Yes,
Are you sexually active with one person or with multiple partners?
one person.
Okay. All righty. Do you guys use any types of forms of pregnancy prevention or no?
She had the operation for 2 times basically.
Okay. All right. Okay. All right. Have you ever had any sexually transmitted diseases?
No.
Okay. All right. All righty. So we don't need to test for that today. Okay. All righty. What else here? Okay. Do you exercise?
Yeah, 2, 3 times a week.
Okay. 2, 3 times a week. Do you include cardiovascular exercises?
Yes.
Okay. Weight training, anything like that?
Yes.
Okay. Good. 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 Any hobbies that you participate in?
Um, Not really reading.
Okay. All right. Okay. All right. Well, let's get started with your exam. Okay. Anything else that I need to know before we get started?
I don't think so.
Okay. All righty. Let's begin. I'm going to perform hand hygiene, and I'm going to first begin with your head. Okay. I'm going to check the head here. I'm checking. First of all, I'm visual looking at the head visually, just to see if I see anything that stands out to the eye here. Just looking, my patient has a head that is symmetric. Now I'm going to feel here for depressions, looking for little mites or anything like that, or dermatitis. Do you ever have any dizziness or headaches or anything like that?
No.
Okay. While I'm here, I'm just going to feel your temporal pulses. Okay. Nice. They're about a 2. They're about a 2. All right. All right. Now I'm just going to slide to the back of your neck here and just feel your lymph nodes. Check and see if they're enlarged. So I'm going to swing around here to these lymph nodes. They don't seem to be enlarged. Just going to feel the neck. Feel around here. Just checking for masses or anything like that. Any pain at all? Discomfort?
No.
All right. Awesome. All right, while I'm down here, I'm just going to feel for your carotid. Go ahead and turn your head towards, just turn your head slightly towards me. There we go. Nice. That's about a 2, 2 plus. Nice. All righty. Okay. All righty. Just get down closer to you because I feel like I'm far away from you. All righty. Any pain during that at all?
No.
Okay. All righty. The next thing, I'm just still taking a look at you, okay? All right. I'm just going to, now I'm going to assess your ears, okay? Have you ever had any issues with hearing at all?
No.
Okay. All right. Any issues with, like, even as a child, like, impacted cerumen, like earwax that you had to get removed professionally or anything?
No.
Okay. All right. Well, I'm just going to take a look into the ears. First, I'm looking at external structures on the ear, making sure they're all present. The auricles here, pinna. I'm going to take a look into the ear. No drainage or redness. Doesn't seem like my patient has any trouble hearing at all. All right, I'm going to whisper something in your ear, and you can tell me what I said, okay?
Hello.
All right. I'm going to take a look at this ear, your left ear. All the external structures are here, pinna and auricle. No drainage, redness, any unusual obstructions in there. I'm going to whisper something in your ear. Tell me if you can hear me, okay?
I love you.
All right. Okay. What'd you say? Okay. Alrighty. Okay. Alrighty. So, all right. Now I'm just going to take a look at your eyes. Okay. All right.
Like a hold them open wide or?
Okay. No, I'm just looking at you. Right now, I'm just looking to see the eyes are plate. Everything on all the structures on the face, like the eyebrows, eyelashes, eyelids. The eyes are symmetric. Nose is symmetric. Lips are symmetric. Go ahead and raise your eyebrows for me. Nice. Okay. All right. Actually, while I'm palpating, I'm just going to palpate your sinuses, okay? Let me know if you feel any pain, all right? You okay?
It's relaxing.
It is actually relaxing having your sinuses assessed. Okay. No discomfort or anything like that? Okay. Awesome. So you said that, do you have seasonal allergies?
No.
Okay. Are you taking any medications at all?
Yes, I'm taking folic acid, Synthroid, prednisone, and warfarin.
Okay. All right. Thank you so much for that. And now I'm just looking at your eyes here, just looking to see if your eyes are symmetric, the pupils are equal in size. Looks like they're about a 4 normally. Now I'm just going to check for to see if your eyes accommodate to light. If your pupils accommodate, they should constrict when light is shined into them. Okay. I'm just going to do a few exercises just to check your ocular motor. nerves and just to make sure your vision is correct. All right. We do not have a Snellen chart available to check your vision, but we can do that another time, okay? Go ahead and look straight ahead for me. I'm just going to flash my light into your eyes and check for constriction, accommodation. Nice. Your pupils dilate to about a 2. Nice. All right. So while you're there, I'm going to have you stare at this pen light here, okay? I'm going to check for convergence, all right? Your eyes should almost cross. All right. It seems like that may be a little bit of a challenge for you. We will revisit that another time, okay? But it looks like you're okay. All right. Let's see here. All right. Now let's check your 6 cardinal fields, okay? Stare at this pen light for me and follow this pen light only with your eyes. Alrighty, one more time. All right, that left eye wanders a little bit, but that is your lazy eye, actually. So you can just schedule an appointment with an ophthalmologist, and just for your yearly checkups, just to keep an eye on that, okay? But do you wear contacts or eyeglasses or anything like that?
No.
Okay.
Since 2015.
2015. All right. We don't have a Snellen chart here to prove that, but all right, we'll go ahead with that. All right. Now let's take a look at your nose here, okay? Do you ever have any difficulty breathing at all? Out of your nose?
No, not really. Just a little stuff, but
okay.
No.
You ever had a broken nose?
Yes.
Okay. All right. Because I can see that there's a slight deviation here. I'm going to hold down one nares, okay? Go ahead and blow out for me. All right. I hear some slight congestion there. Go ahead. Okay. All right. Yeah, it seems like you have a bit of an obstruction there, okay? I'm not sure if it's mucus related, sinus related, or if it's from, you said you've never had you've had the triple bypass, but you've never had surgery for your nose.
No, when it got broken, they said I could either let it heal, if it didn't look right, I can have surgery, but if it looked all right, I didn't need surgery.
Okay. All right, then. All right, so I'm just going to take a look at my pen light up your nostrils, your nares, okay? All right. Checking for discharge or drainage, redness. All right, the adenoids are present. They're pink. There's a lot of hair present, but that's natural, especially for men, okay, to have excess amount of thick hair. All righty, dear. Okay, so you said no problems with smelling or anything like that, right?
No.
Okay, let's go ahead and close your eyes for me. I'm going to have you smell something for me and tell me what you smell.
Salt, pepper, seasonings.
Salt, pepper, seasoning? That's a pass. Alrighty, so this over here. Alright, so let's move on to your mouth, okay? When's the last time you've been to the dentist?
I'd say about 6 months.
Okay, 6 months, good. You should visit the dentist every 6 months, which is twice a year, okay? Alright, go ahead and say ah for me, sticking your tongue out. Ah. Okay, you can stick your tongue back in for me, but open your mouth for me. I'm just taking a look around the teeth and gums. Go ahead and stick your tongue out again. I'm going to check your gag reflex, okay? All right. Okay. You passed. I'm sorry. Okay, so the oral mucosa is present. Is moist and pink the way it should be. The uvula is present. The tongue is pink and moist the way it should be. There are no lesions present. All teeth are present. Let's see. I'm sorry. Open your mouth for me one more time. And put your tongue at the roof of your mouth. Nice. All right. You can relax for me. The hard palate is pink the way it should be and intact. No lesions again present. Okay. Do you ever have any troubles with taste or anything like that?
Nope.
Okay. All right. So while I'm still on your head here, okay, I'm just going to check and see. I'm just going to check some facial nerves, okay, sensation. Go ahead and close your eyes for me. Let me know if you feel something soft or hard.
Soft.
Keep your eyes closed.
So, a little harder. Hard.
Okay. Alrighty, you passed. Alrighty, so I'm just going to feel around. Again, I'm going to just make sure to feel these lymph nodes down by your clavicle just to make sure everything's all good. Make sure there's no enlargements of the lymph nodes or anything like that, or masses around the neck. Okay, go ahead and lift your, resist me and try to lift your shoulders. Nice. Resist me and try to open your mouth. Close your eyes tight, resist me, and don't let me open them. Nice. Alrighty. Open your eyes for me. Look to the left and to the right. Oh, we did that. Alright. Okay. Alrighty, I was just retouching that because there was a little lag there. Okay. Alrighty, dear. So let's move along. Actually, while I'm here, I'm just going to check for your pulses, okay? I'm going to check your radial pulses, which are nice 2 plus, 2 to 3. Nice. I'm going to check your brachial. You see me? Nice. It's about a 2. All right, about a 2. Okay. And actually, while I'm doing your pulses, I'm just going to check for your popliteal pulse behind your knee. It's present. It's about a 2. Stretch your leg out for me, dear. All right, it's about a 2 in the popliteal behind the knee. Now I'm going to check behind the ankles. Posterior ankle. I'm also going to check the dorsal pedis pulse on the anterior foot, right before the toes. All right, you doing okay? All right. All right. All right, I'll just check your pulses there, and all of them feel they're not bounding or anything like that. Make sure you can see me, Professor. Not bounding or anything like that. They're about a 2 plus or so. So we're moving on to your thoracic cavity, okay? I'm going to spend a little bit more. I'm going to listen to your heart first, okay, and then I'll listen to your lungs because I have to spend a little bit more time there since you talked about that cough and that shortness of breath. So due to your hypertension, anyone else in your family have hypertension?
No.
Okay, all right. Do you ever have any palpitations or chest pain unrelated to the cough?
No.
Okay. Okay. You did have the triple bypass surgery, though. Okay, I got to keep that in mind while I'm listening. Okay. Alrighty. Any chest pain during like for instance during your exercise or during cardiovascular activity?
Chest pain?
Chest pain during cardiovascular activity.
No.
Okay. Alrighty. Okay, so I'm just going to grab my stethoscope here. I'm just going to take a listen to the heart, okay? All right. First point I'm going to listen to is the second intercostal space to the right of the sternum, which is the aortic valve. Sounds normal. Now I'm going to move right directly across from it, second intercostal space to the left of the sternum, which is the pulmonic valve. Sounds beautiful. Erb's point, third intercostal space to the left of the sternum. Fourth intercostal space, mitral. Now I'm going to move down to the medium of the sternum, the bottom of the heart. I'm going to hang out here for 60 seconds for the apical pulse. I'm looking at the clock. All right. 74 beats per minute, which is normal. The normal heart rate is 60 to 100 beats per minute, okay? Alrighty, now I'm going to take a listen to your lungs, okay? Just going to have you, speaking of lungs, okay, so you say you had the cough for 6 days with yellow and green sputum, correct? Okay, you have chest pain with that cough, and you have shortness of breath and physical exertion, correct? Okay, alrighty. Do you have a history of asthma?
No.
Any family history of lung diseases?
No.
Okay. And outside of these 6 days, have you ever experienced any pain like this before?
No.
Okay. Or any symptoms like this? Okay. All right. Okay. Let's take a listen. No history of childhood asthma? Nothing like that?
No.
Okay. All right. Have you ever had a positive TB test?
No.
Okay. All right. Deep breath in for me. And out. All the way up. Don't let carbon dioxide. Don't hurt your lungs though. Take your time. It's okay. Just breathe. Breathe clean and deep. Not too crazy. C99.
99.
Deep breath in. Deep breath in. Okay. All right. Now I'm going to listen to your posterior lung sounds, okay? All right. So we're going to have to do what we did the last time. So just turn towards me a little bit, okay?
Towards you?
No, your back, I mean. That's perfect. Trying not to show Eli over there. All right. Yes, hug yourself because that allows for the clavicle to open up. You can sit up and do that. That allows for the clavicle to open up and for the lungs, for you to hear the lungs clearly. There are 8 spaces back here. Deep breath in. Out. Deep breath in. Nice. Out. Deep breath in. Out. In. I'm paying special attention to the right side. Say 99.
99.
Okay. Alrighty. Thank you. Good job. Okay.
All right.
Alrighty. So moving right along to your abdomen. Okay. Let's talk about your diet a little bit. Are you eating 3 meals a day?
Yes.
Okay. How's your water intake? Are you drinking like at least 8 glasses of water a day?
Yeah, just about. Yeah.
Okay. All right. Do you ever have like any excessive amount of gas or anything, or constipation?
No.
Okay. Good. You're eating your veggies.
Yes.
Okay. All right. How's your stool? Are you making a bowel movement every day?
Yep.
Okay. Would you say that the consistency is more of a formed, solid, brown shape, or would you say that it's more loose, a different color?
Solid.
Okay. So you would say that's normal. It's normal.
Yes.
Okay. All right. And as far as your urination, any pain with urination or anything like that?
No.
Any pain with bowel movements?
No.
Okay. All right. And as far as the color of your urine, would you say that it is more of a pale yellow or more of like an amber color?
It's a light yellow.
Okay, good. That's exactly the way it should be. All right. So before we get started, I am just going to have you take a sip of this water here. And while you do this, we're going to test two things. I'm going to listen to your abdomen in a second, but then I'm also just going to put my hand here and just feel your throat, okay? Just to make sure that your trachea is moving here. Go ahead. Take a sip. Checking your swallow. Nice. All right. All righty. Okay, dear. Now I'm going to take a listen to your bowel sounds, okay? I'm going to have you lay down for me. You need your sheet? Go ahead and lay down. Okay. All right. All right. So I'm just going to, you have 4 quadrants that I'm going to be listening to, okay? Let me know if at any point during this procedure, during this assessment that you're having any pain, okay?
Sure thing.
Nice. I think that water's working. All righty, dear. You have active bowel sounds, which is great. Um, but before you get up, I'm going to palpate, okay? Let me know if you feel any pain during this, okay? Any pain?
Nope.
There's no distension in the abdomen. It's tender, the way it should be. Soft. And no pain. Feel no masses. Also, the the abdomen the skin is warm, the way it should be. I'm going to take a look at while you're lying down here, I'm just going to take a look at your hands, okay? Checking for capillary refill. Do you ever have any numbness or tingling in your extremities, like your fingers or toes or anything?
No.
Alrighty. Capillary refill is less than 3 seconds. Nice. Alright, while you're here, grab my fingers and squeeze them as hard as you can. Tight. Nice. Nice and strong. Alrighty, go ahead and sit up for me, dear. We're going to go, and we're going to start with your musculoskeletal. Go ahead and sit up for me. Okay, bring my chair closer. I'm only sitting in the chair, Professor, because I'm tall. I want you to see me. Okay, alrighty. So I'm gonna have you. Okay, let's first do some range of motion. Okay, I'm gonna have you move your head into a circle like this, like 360. Nice. I'm gonna have you raise both hands up for me. Nice. I'm gonna have you bring your hands straight like this, and then make your hands go into a circle, okay? A range of motion for your wrists are good. All right. Perfect. Okay. Um, I'm going to have you stand up. We're going to stand up. Do the rest standing up. Let's see. Make sure she can see us. Okay. All right. So I'm going to have you put your arms straight out for me and close your eyes. I'm just looking for a drift. Alrighty. And now I'm going to have you try to resist me. Push my hands down. Nice. And lift your hands up. Push me up. Nice. All right, relax your arms for me. Okay. I'm going to have you raise your arms like this, like strong man, all right, and try to push me out. Nice. Try to push me in, bring me in. Nice. All righty. And I'm going to move to your legs, okay? Actually, sit down real quick. Okay, I'm going to have you try to kick me out. All right. Pull me back in. Nice. We're going to do the same for your feet. Try to push me up. Push me down. Nice. Feet, push me up. Push me down. Nice. Try to kick me out. Try to bring me in. Nice. Try to kick me with your knee. Bring it up. Nice. Try to kick me up with your knee. Nice. All right, now we can stand back up. I apologize. See, we're getting our exercise in. All righty. Now, I'm going to have you take a few steps back. Move my chair. Okay. I'm going to have you with have your hands at your side. And then I'm going to have you close your eyes and walk to me heel to toe. Nice. Okay, you can stop right there. Okay, a little unsteady, but I believe it might be the circumstances of the small area that we are in. Do me a favor. I want you to lean over and touch your toes for me. I'm just going to feel your spine to make sure that it's in a line. Okay, that it's a line. That it's straight, pretty much. No signs of scoliosis. Okay, all right, dear. You can lay up for me. Okay, I'm going to have you move your hips in a circular motion, checking that range of motion there. Nice. All right. Okay, let's see. All right. Do you ever have any difficulty walking or pain in your joint? Oh, another thing. Okay, I'm just going to feel your joints, okay? Feel your knee. Actually, have a seat for me really quick. I apologize. I just need to check your joints for crepitus, okay? Go ahead and kick your knee out for me. Nice. I don't feel any cracking. One more time. Nice. I'm going to do that again here. I'm going to put my hand here on your knee. Let me know if you have any pain. Okay, go ahead and kick your leg out for me. Nice. No crepitus. All right, I'm going to check the same thing in your elbows, okay? Go ahead and bend your arm up for me. Nice. Nice. No crepitus there. Nice smooth movement. Nice. Okay. Smooth movement. Okay. All right. So there was range of motion in the elbows. There was no crepitus in each elbow, and no crepitus in the knees either. All right. All righty. So just to briefly just go over what I assessed during your lung assessment. Okay. I did notice that in your right upper quadrant, right middle quadrant, and right lower quadrant, that you were having some bronchi, that I heard some bronchi. Bronchi is a breath sound, pretty much. There are different type of breath sounds like wheezing and things like that, but I heard a bit of bronchi. Bronchi is like a low-pitched, like wheezing / like snorus kind of wheeze. Okay. And what it is inside of those bronchioles, so that mucus, which is probably like that mucus that you've been coughing up, that mucus is congested inside of it. It's built up inside of your bronchioles. So in order to clear that sound and that congestion, you have to cough. You have to cough it out. So that that's your body's natural way of getting rid of that mucus. Okay, it's like a signal. Hey, it's time to get that stuff out. It's like a natural response. Okay. So continue to cough and spit that mucus out. Okay. But yes, that is what I witnessed. I am going to document this information and share it with the physician. Okay. Do you have any questions for me today?
No, not at all.
Oh, I forgot to actually ask one thing. How's your sleep?
I get a good 6 to 8 hours a night.
Okay, and do you feel like you're waking up a lot in the middle of the night, or you waking up to urinate or anything like that in the middle of the night?
I wake up, go right back to sleep.
Okay, all right. Okay, no clenching, grinding of teeth or anything like that in the middle of the night? Okay, all right. Okay, all righty. Well, that was nice. All right, thank you.